Right.
So thank you everybody for being here and for taking the time, to Dr. Shirazian and Mommy Matters, and to everyone who's attending right now in the middle of the day. I know it's not easy, but this is super informal. As you can see, I'm just like in my kids' playroom right now. Dr. Shirazian is in a much nicer setting, but I feel a little less bad about myself because it's not her house. And I just want to start out by introing who we have here. If you're not familiar, I guess I'm going to say Tara then, because otherwise,
Perfect.
I'm going to slip. But Tara is an OBGYN and is the founder of Saving Mothers and Mommy Matters. And she's been doing charitable work for years and years, working across the globe, but right now has been on the front lines of this pandemic, literally hand delivering groceries to people in need, and providing diapers and wipes and formula. And she's going to tell us a lot more about that in a bit. And we're just so excited to have someone who is so committed to helping people, and also a well of knowledge who can help us today with a lot of our questions. We're really grateful to have you in this webinar. I know how busy you are as a mother and a doctor, so thank you. And then we have Erin, who is the founder of Totum Women. She's an attorney, she's a mom, she's one of my best friends. Totum helps mothers feel whole in body, mind, ambition, and relationships. She has a beautiful online community that is right now really concerned about pregnancy and postpartum during COVID. And together, we wanted to put our communities together and try to address a lot of the concerns and fulfill this need that we felt really needed to be addressed right now in a real and sincere way. And then in case you don't know me, I'm Alexis. I'm the founder of Not Safe for Mom Group. We talk about the real and raw side of motherhood. We don't hold anything back. It's a judgment-free space, stigma-free space. And I wanted to bring that kind of sensibility to this conversation where you don't have to hold anything back. You can ask us anything. We can bring up anything during this conversation. I'm going to transfer it to you, Erin.
Yeah, sure. So yes, again, thank you to everybody for being here, and so grateful that Alexis brought us all together. One thing that I'm noticing our community talking about is how healthcare priorities and norms shifted really quickly. And, for pregnant women, you're at a time where you feel like you're the center of the universe and your doctor's checking in on you all the time, and it's a priority. And now everything's about COVID-19. So a lot of women are feeling like maybe they shouldn't bother their doctor. They're feeling like they don't have the same support that they had. But the fact is, I was writing through this and I was thinking, yeah, we feel like we can only talk to our doctor if it's a matter of life and death. But what's more important than a mother at carrying forward a new life? And so we're really here all with the intention of supporting all of the women on this call and helping you know that this is very important. Even though we are in the midst of a global pandemic, your experience and the life inside of you, it's as important as it's ever been. And we want to hold you in that and support you. And so with that, there are a lot of different questions that have been coming in from both of our groups. I know Alexis wanted to talk through some of the sense that she's getting from her community. I know with our community, they're all over the board. And so we have some questions here. We have some general questions, specific questions, and you all can use the chat function. Please don't hold anything back. Like, go into chat, ask the questions. If you came in with something burning, put it in there right now, because Alexis and I are going to be moderating that. And some of the questions that we'll ask on our end, coming from our communities, will kind of warm up the discussion so that you can feel free to ask, but we want to address all of you who are here and respect that.
I just wanted to bring up the fact that I'm feeling a sense of panic from people.
Yeah.
In Not Safe for Mom Group, you can send in questions anonymously and spark a conversation. And what I feel when I read the questions having to do with pregnancy or IVF, TTC, postpartum, it's just, there's tremendous anxiety and panic because so much is unknown and so much has been unanswered. And we don't know where to go. And there's just like this helpless feeling. And usually what I do is I bring to mind, like, here's the conversation, let's highlight it, but there's not really an answer that I can provide. And so it just didn't feel like enough. And I'm really excited that we're going to get to finally get somewhere closer to an answer today, hopefully. I wanted to hear a little bit more about Dr. Tara's work. It's because it's so relevant to the whole discussion, and it talks about, it speaks to how underserved we are in general in our healthcare system, and specifically people who are more marginalized, and the communities that are definitely being ignored right now. So can you tell us a little bit more about what Saving Mothers does and the work that you've shifted over to?
Absolutely. So thank you first off so much for having me. As you know, I think these conversations are extremely important and valuable for all of us. And, you know, pregnancy, maternal health, women's health, it's, you know, always been my number one priority. And I hope, you know, a priority for all of us because it's extremely, extremely important. So it does upset me to hear that people think, oh, well, maybe I can skip my visits. Maybe I don't need to do this. I don't want to bother others. No, you are the priority. There is nothing more important than your health, not only for you, but for your family, for your partner, for your children. And so through Saving Mothers, which I started in 2009, we have basically been prioritizing maternal health around the globe for the last decade. We create low-cost, high-impact programs for women in the most underserved areas around the world where women don't have access to clean, safe deliveries, where they don't have doctors, where they only have birth attendants, where they can't get a C-section, and where maternal death rates are the highest. So we work in Kenya, Guatemala, we've worked in Uganda, across Africa, we've worked across Central America. And actually this year we launched a New York City program. It's called our Empower program. And it's a program geared at the underserved women here in New York City. Ironically, we started this program before COVID-19 to really start empowering the community health workers and educating mothers in the various underserved areas of New York. And then, of course, COVID-19 happened, and now these same communities are even more underserved. So we've been working harder than ever, as you mentioned, kind of delivering supplies, delivering food, formula, diapers, just trying to get basic essentials out to our pregnant women and into their homes. So Saving Mothers is very close to my heart. This year we launched Mommy Matters, and I can talk about that a little bit later, but it's our initiative to kind of include everyone in our Saving Mothers purpose and agenda, which is that no woman should die giving life, and that maternal health should be a priority for everyone. So today I'm here to talk about whatever you guys want to talk about, pregnancy and prenatal care and all of the rest. And I hope you'll check out savingmothers.org, which highlights our work for women around the world. We're having our Mother's Day campaign now. You can get a Mother's Day card for your mom, and the money will be donated to our programs for women.
People with information on how they can get involved too, especially locally. If you're in the local New York City area and you want to help, we're going to include information on how you can also be a part of the Saving Mothers initiative, and we'll do that by the end of the call, and then also include it in social and updated newsletters about this discussion. I wanted to have a sense from you also of how prenatal care has changed, like in the most meaningful ways for you as a doctor.
Yeah, so I think that some women have noticed that, prenatal visits have been more limited. And at the start of this entire pandemic, we very much were trying to limit prenatal visits where we could because we wanted to limit exposure. It's not because we felt like prenatal care is not important, because it absolutely is. But I think there was an attempt on the part of hospitals and communities to limit the traffic, limit the number of people coming into the office so that we could limit exposure. Here in New York City, that is all starting to change slowly. So we are having now more people in the office, but I don't want people to confuse not thinking that those appointments are not important with trying to minimize potential exposure. So if your doctor tells you you have an issue and you're pregnant and you should be following up with visits, you should absolutely come in for your visit. You should just wear your mask, wear your gloves, minimize any exposure, but come in for the visit. Because what we don't want to happen is we're dealing with one issue, COVID-19, but we're creating all these other issues and potential problems for women, right? We want to avoid complications. We want to predict things early. We want to serve women early so that things don't become an issue down the line. So please keep those prenatal appointments. If you think that it can be skipped, just send your doctor a message. Almost all of us are doing telehealth visits. You can do a telehealth visit and say, doc, you know, I've been good. Like, do I really need to come in? I feel the baby moving. Are there any tests that I need to do at this next visit? So that you have a better understanding of your specific case. But
that's really valuable, and it really maps kind of what we're hearing on our end, where women are deciding that they're maybe not as important, and you're seeing that they're not showing up. So I think, you know, through Totum and Not Safe for Mom group, we can really help bolster women's sense that you are meant to still take this seriously. Don't skip appointments. Don't get into the mindset. I think, you know, back to the word panic.
yeah,
I think a lot of women, when they heard that partners might not be able to come in with them for delivery, they took that to mean something bigger, that
right.
the healthcare community was dismissing their pregnancy and all of that, rather than looking at that as one measure to try and keep everybody safe. I think women heard something different than what was being said.
Yeah.
And so I love what you're saying. And I think we can, not only with the group that we have here, but I'm happy to follow up, you know, in our newsletters and our communications, just saying, please, your doctors want to see you. They take you so seriously. They take your baby seriously. So thank you for saying that.
Yeah, it's super, super important. And I get more worried when people say we're not going to come in, honestly, because then if there is an issue, we won't know about it early on because it hasn't been seen, it hasn't been communicated, and there could be a whole other constellation of issues that develop. So please keep those visits. And I think, remember, it's hard, but because it was such a big thing that was said in the news that hospitals are not going to allow your partners in, but that was overturned here in New York. So the governor said, no, we don't care, COVID-19 or not, partners are coming into all the hospitals. Our hospital actually never banned the partners, but some did. So it was nice to see that was reversed, because honestly, in the grand scheme of things, I personally don't think it makes that much difference. And it's it's so important for a pregnant woman to have her advocate, her partner with her. And that was a minute, guys. So that's done. You can bring your partners. You should go for your prenatal visits. And pretty soon in the next few weeks, honestly, things are going to normalize even more and more and more. So we were skipping some ultrasound appointments where it was maybe not necessary, but, you know, I think everything is pretty much going to go back to the routine, you know, in the next few weeks.
That's really good to know. I want to roll it back a second, because when we were looking at the questions that we got from our communities, and now I'm already seeing it happen in the chat, there's been a cluster around the very beginning of pregnancy journey, which is, should I be trying to conceive?
Yes.
Some women were saying, you know, I've had a few losses and I'm interested in trying, and now I feel like I shouldn't. Some are saying, I feel like I might be nearing the end of my fertility journey, and I'd love to be able to start after this is all over, but I don't know that I can. I just wonder if you can give some words of wisdom, some assurance around that.
Yeah. So I myself, you know, if you asked me last month, would have said, you know, now is not the best time. Like, I would wait like 2 months. And the reason that I say that, and, you know, now we're getting kind of closer to, I think, you know, maybe like 1 more month would probably, if you wait 1 more month, that's probably going to be nearing the end of the time where things are sort of still, we're still in the thick of it. But the reason is twofold. One, and I think the more important reason, is that we unfortunately never know exactly what's going to happen in early pregnancy. So you're much more likely to need additional care in the early part of pregnancy, because things like miscarriage unfortunately happen, you know, in like 1/3 of women. Ectopic pregnancies happen. And, you know, when those things happen, women are acutely in need of services. So I think when you're acutely in need of services, it makes you very anxious to go into the hospital. And just, I'll give you a case in point. On a video visit, I diagnosed someone with an ectopic pregnancy.
Wow.
And she started crying, you know, because she was so scared. She wasn't crying because it was an ectopic necessarily, but more that she was so scared because I was telling her we needed to address this urgently, maybe surgically, you know, maybe with methotrexate. And so I think that it's the like needing of other services that also makes women really anxious at this time, right? If I were to tell you, you need to come to the emergency room right now, that's more anxiety provoking. So just in trying to decrease the level of anxiety and need for other services, I think that's the most compelling reason to wait like till the end of, you know, this period of peak of crisis. So I would say 1 more month. And I understand that people want to get pregnant. And I understand that a lot of women are aging and, you know, don't want to wait any longer. I totally hear that and think that's important. IVF services have been suspended right now. We're not doing IVF across the country. So most centers are not offering those services because in an attempt to, again, reduce traffic, not have so many people coming in, and not starting new medical treatment right now when things are uncertain, because it leads to potentially needing more medical treatment. So that's, I think, hopefully another month, maybe 2, that's my guess, and then things will get back to normal, hopefully.
Feeling of like, I heard this word a lot, like, is it irresponsible to try to conceive now?
I mean, you know, irresponsible is a really big word. I don't really like that word, because to tell you the truth, I think it definitely depends on an individual person's situation and circumstances and need, and also just things happen. And I don't want people to feel, I feel like the reason I don't like that word is it heaps so much blame on the woman. Yeah. So I really don't like it, because we use it for so many things. You know, you hear it in the press for so many things, like, yeah. So I would not say irresponsible. I would say, you know, if you are not currently pregnant and you're thinking about whether to become pregnant, I probably would discourage it for another 2 months. That's what I would say.
2 months isn't that long.
Yeah. And I would put it in context. You know, it's not forever. In the meantime, you can track your cycles, see when you're ovulating, take a prenatal vitamin, you know, gear up for it, make sure any medical issues are in control, you know, so it's not as if you can't use the time. So
someone had a question about the effect of COVID medications on newborn neural development.
Yeah. Right. That's an interesting question. So we're not using, so if you are pregnant and you're in the first trimester and you're being like hospitalized for COVID, there are maybe some medicines that are being given. The antiretrovirals like remdesivir, which has been in the press a lot, and all of this, none of this is consistent, by the way. There's no consistency surrounding which meds are currently being used. Like, there are a few different ones that are being tried. But that particular medicine should be fine, should be okay in pregnancy, because we do have HIV in pregnancy, although that's not the one that we typically use. So the bottom line is a lot of medications have not been studied, but we also don't know of really bad effects with many medications in pregnancy. So.
And there was even a woman along those lines who had said, is there something like with Zika, we were hearing about, you know, these specific things that would happen in newborns. Is there anything like that just with having COVID?
That's the good news. That's actually really the good news. And I was going to start this with that. The data to date, the vast majority of the data, right? Nothing is ever 100%, but the vast majority of the data says that pregnant women are not at more risk for severe disease than non-pregnant women, which is a huge deal, because with most infections, pregnant women are at risk for more severe disease, but that does not appear to be the case with COVID-19. You know, that having been said, everyone has a story of someone they know maybe who's pregnant and who has it and who's sick, but the majority of the data does not support that. So that's good. And then very few newborns have been diagnosed with COVID, and it's thought to really not cross the placenta. So in general, newborns are also do not look to be at significant risk. So that's also really good. And even kids under the age of 10 don't seem to be at significant risk. So all of those categories should be very reassuring. You know, imagine if, you know, I have 2 children, imagine if it affected all the kids, like we would be beside ourselves, right? So, so I think that the data we have so far is very reassuring in all of those categories.
It's great to know.
Back to what you were saying about going to your prenatal appointments. I believe that means that the partner is not supposed to attend the prenatal appointment.
Right.
Some of our community was asking, how can we, or do you have suggestions of how can we make our partner feel involved, even though they're not allowed to physically be there?
Yeah, well, I imagine in this age of like video conferencing that everyone should have their FaceTime on at a minimum. And, you know, I personally have gotten one of these because I have to do these telehealth visits, but I've been telling my patients, it's not a bad gizmo. These, I forgot what they call them, Osmos. You can set it, you put your camera on it, and you can FaceTime and it just sits there. So like I would put it in the corner of the room and put your cell phone on it and capture the entire visit. And then if your partner has questions, they can ask questions at the same time. I mean, that's what a lot of my patients have been doing. And like with video visits, same thing. You know, they just bring their partner or family member in with them and we all chat together. So I probably have spoken with more family than I do in person, because there's the ability to bring people up to your cameras and phones and have them involved that way. And I don't think your doctors will say no. I mean, I'm pretty sure all of them are doing it. So.
Yeah, there's one woman saying her provider isn't allowing FaceTime either.
Oh, weird.
Why is that? Is that a HIPAA thing?
It might be a HIPAA thing. It might be that they don't feel comfortable because of sort of liability stuff. But I honestly don't think that's the majority of people. I mean, I think for that particular woman, I would just maybe outline your visit before you go. Like, these are my goals for the visit, talk to your partner about it. And then you'll see your doctor and just make sure you hit all those goals and you can relate, you know, what happened back to your partner so that they're involved. But like, you know, kind of creating a little list for yourself. Like, today I'm going to get my ultrasound. This is what I want to know. This is what I'm going to ask. And, you know, get some buy-in before the visit. And then afterwards you can talk to your partner about it.
Related to that, we had a couple of people ask about postpartum. How do you feel about grandparents coming to visit, close family?
Yeah, it's a little harder, the grandparent category, because we know that there's so much asymptomatic carriage of COVID-19. You know, my own parents, I have not seen them, which I have discouraged them from seeing me. So there's that. But you know, I do think that with that particular category, you probably want to be as safe as possible. That doesn't mean you can't wear masks and maybe be outside and see them in a setting that's spaced apart, because honestly, I think there's probably very little risk there. So if you live somewhere that's a little warmer, or even if you're in New York and bundled up, maybe that's a way, you know, to show the baby off. And I know that like FaceTime and Zoom and stuff like that, it's not quite the same, you know, but of course, I would encourage everyone to use all of those modalities, but maybe outside at a distance with masks might be another answer.
Yeah. I saw someone, one of the women in my community, her parents drove 4 hours so they could meet the baby through the glass.
Yeah. I know. I've seen pictures of that on social media. That's amazing. I think, you know, being able to show people, to show the newborn through glass is fabulous. I mean, I don't know that I worry so much about like the newborn exposure to the grandparent, right? It's more the parent's exposure to the grandparent. That's what I would say.
Yeah.
Because we have so much asymptomatic, again, it's just this asymptomatic carriage. So many people are asymptomatically infected. We don't know. But, you know, there's a light. I'm hoping that with antibody testing and testing more people, you know, in the next few months, we'll have more answers as to, you know, who's protected and who can maybe talk to their parents again, their grandparents again.
The antibody test, I don't know if you know the answer to this, that if you do have the antibody that you're kind of good, or is there that worry because
no, there's still a lot of uncertainty around the antibody test. And so I also wouldn't encourage people to go out and spend money on tests that haven't been validated, you know. I think we still have to sit tight on that, because I don't think there's a right answer yet there.
How about protocols and just with delivery related procedures? Like, are there the same number of cervical checks, or just, I guess, generally, can you talk us through what has changed, if anything?
Yeah, I think for the non-COVID woman, little has changed, except that you may get COVID tested when you enter the hospital. A lot of labor and delivery units are looking at universal testing right now. They're not all doing it yet, but that's where we're headed, so that every pregnant woman will be swabbed, which, by the way, is not a fun test. But it's a nasal swab. And so they'll swab and get the COVID test when you come in. Those who do test positive are going to be treated differently. They're going to be in a negative pressure room. They'll be, you know, isolated. They will have the choice of, but their doctors will be the same. The doctors will just gown up and wear protection and come in and come out. Nurses, same thing. So it'll just be that the protocol is different, and it'll be a little weird because everyone will be in these space suits, you know, sort of thing. But this number of checks, the management, all that is the same. The only other thing in management is, you know, when women had a fever in pregnancy, we never used to think about COVID, but now it's high on the list of things we think about. So, but the universal testing will probably eliminate that concern, because we'll know at the beginning who has COVID, who doesn't. And then with the newborn, you know, we give the mom the choice, if they're COVID positive, of either being with the baby or separating from the baby, so the baby can be tested and managed separately. So there's that. You can be with the baby, but the CDC, the WHO, some of the major organizations don't quite recommend it yet, because even though we don't think COVID's passed in breast milk, we're not sure if, like, you know, that initial sort of breathing on the baby, being with the baby, can impart any risk. So.
That's a tough choice.
Yeah. I think a lot of women are opting to just wear the mask and be with the baby, which I think is probably okay, but it's not the recommendation currently from the major health organizations.
One woman wrote in the chat that she's hearing that women with uneventful vaginal deliveries are only spending 1 night in the hospital as opposed to 2. Is there any system set in place that that follows up with those women other than the standard 6-week visit?
Not to the best of my knowledge, but that is true. And it's been done to, again, minimize days in the hospital, exposure, hospital space, all the above. I mean, for most uneventful vaginal deliveries, 1 day is probably okay. The big thing that women should just be cognizant of is if they start to not feel good after delivery, like headaches that won't go away, vomiting that's getting worse, probably the one really big thing, or there are a few big things, but the one biggest thing is the category of high blood pressure and preeclampsia. So they should check in with their doctor if they notice any unusual symptoms, shortness of breath, headache, nausea, vomiting, visual changes. Those would probably be the top ones.
We have a specific question about IVF. Are you able to read the chats?
Yeah, there's just been so many. I wasn't sure what we are. Yeah, which one?
Eden, is that the one you're looking at, Alexis?
Yeah.
What time is it? Sorry.
I'll read it to you. My wife had a successful IVF embryo transfer on 4/2. We both tested positive for COVID-19 on 4/18. Our only symptom was loss of smell and taste. We've both been clear of symptoms for over a week. Since the embryo was quote unquote made prior to exposure, is it at a lower risk? Also, if my wife made antibodies, will the fetus also get them?
These are good questions. Probably since the embryo was placed prior to COVID, I would say that risk is likely very low. And the fact that she was infected doesn't necessarily increase the fetal risk because we still think it doesn't cross the placenta. And yes, most maternal antibodies cross the placenta, so COVID should not be different, although we don't have any specific evidence related to COVID, but most maternal antibodies do cross. So probably there is some protection there. But I think the big caveat here is please don't practice anything because you think you have antibodies. Do not change behavior just because you think you have antibodies, because there have been lots of people who've been exposed who do not develop antibodies. So there may be something about the degree of exposure, the amount of exposure, the type of exposure that will create antibodies when others won't. I don't know. We don't know that answer. So all I'm saying is just don't count on, wear your mask, wear your gloves, limit your exposures, because we don't know if anyone has antibodies, and the testing right now is also not very sensitive. So
we have a question having to do with advocating for yourself and your baby at a hospital where they're requiring partners to leave after the baby is born.
Yes.
And being worried if you're in pain as a mother and you don't have anyone there for you to be your advocate. I'd love to talk about that. And then I think that would be a great segue into you also addressing what we were talking about earlier in the call, which is the issue of maternal mortality and your feelings about that at this time, especially in populations that were already experiencing greater maternal mortality.
So honestly, I think having an advocate with you is extremely important in general. I think, after delivery, it's tough because you're tired and you may not know what's what, and you're just kind of recovering from a delivery. So it's sometimes hard to articulate what you need. We are all one team. So there are nurses that are there for you at all times. So you should be able to call your nurse and ask for anything you need. Nursing in pretty much all hospitals are, very few patients to each nurse so that they can really address concerns as they arise. Pain should be treated. So if you have a lot of pain, you should be asking for pain medication. I think sometimes women try and be very tough and say, no, I'm not going to use anything. I don't need anything. But if you're in pain, you can't be the best that you can be for you and your baby. So I would encourage pain medicine if you have so much pain that, you know, you're sitting there uncomfortable. And again, I think I would just encourage, again, the video visits, the, you know, trying to get your family member on the line and saying, look, I feel like this, what should I do? If you don't feel comfortable articulating that yourself to the nurse or to the doctor, because that's really another way to get an advocate to help you. And also, when many of us call our families, they usually yell at us and tell us to do X, Y, and Z. So
I think underscoring, there are a couple here underscoring the fact that they're hearing that partners are asked to leave afterwards. So what you're saying is basically find a nurse to articulate.
You have a nurse. Everyone has a nurse.
Right. And so identify, I should say, a nurse that you want to have as your advocate and keep that communication line open, you know, I guess the whole way along. And maybe there's even an opportunity to empower that partner. So if a birth partner comes in, say, hey, I'm a little busy right now giving birth. Can you, you know, find our advocates here and let them know what I need, what our intentions are. It sounds like there almost has to be a plan to identify the nursing staff who will advocate for you after the partner leaves.
Yeah. I mean, you will have a nurse with you all along in labor, right? And then postpartum, you'll get transferred from the labor unit to a floor, and you will have a nurse, and you can push your button and call your nurse at any time. If you find that nurse is not coming or you can't find her, there's a nurse in charge that you can ask for at the front desk. And there's even like a patient advocate in every hospital. So if no one answers you and you don't know who to talk to, you can call your patient advocate and they will call you and make sure you get what you need. So you definitely have rights in every hospital. And if you feel like no one is hearing you and not listening to you, you go up the chain until you are heard, because, you know, you should not be ignored.
And this question, I feel like this question's coming through in a lot of different forms. Like there was a question around home birth, a couple of those, where women were saying, you know, in the midst of, even though the law changed back to the partner can come, I think women started to think, what if that happens again and my partner can't come? And some women have switched into a home birth plan, knowing that they may end up in the hospital anyway if there's a complication. So there's some questions around, if that was the course that they decided upon, how do they advocate for themselves if they land up at the hospital? So there's a lot here about advocacy.
Mm-hmm. I mean, advocacy is hard, but I think, you know, the important thing right now to kind of realize is, even though COVID-19 is happening and it seems like the world is in chaos, labor and delivery is its own protected place. It's like your safe haven. Mm-hmm. Not that much changes on labor and delivery except for how we treat the COVID patients, right? And some of the rules surrounding traffic, which is, I think, what everyone else is talking about. And the rules around traffic have to do with, you know, advocacy, which I understand, I think, and we can talk again about that. But labor and delivery, it goes on, and labor and delivery doesn't change that much. We do what we do because that's how it's always been done. So if someone were to have a home birth and arrive on labor and delivery and we're having a complication, our protocols for complications would be activated. Like if they were having a postpartum hemorrhage, we would address the postpartum hemorrhage. So you will still get care. What worries me about home delivery, and I've said this in other platforms, is just that you're at home. So if the only way you would be coming to a hospital is if you had a problem, mm-hmm. and the referral to the hospital may be slowed, mm-hmm. right? So if you're calling 911, that response might be slowed. Mm-hmm. So I worry about home delivery in general for that reason, like mm-hmm. that referral process could be slowed, but everything that will happen like in a good time would happen now. once you get to the labor floor. So we would be probably addressing some type of complication, because that's really the only time when home deliveries come to the hospital.
Really helpful. How about, has there been any change in the staffing on lactation consultants?
That was a question we had a lot.
Yes. So actually, some things you could do ahead of time, or do some of these virtual consults, which I know a lot of people are starting to sort of think about, but CPR, lactation, you know, a lot of moms have been telling me they'll do like prenatal classes, yoga, things like that. I mean, I would take advantage of some of that ahead of time, because maybe more of us have a little time right now. And there definitely are ways to prepare that sometimes we don't get to do in a good time. Like, people don't get to take that CPR class or get to really think about what they would do with the baby in an emergency, for example. So I kind of think that's one positive. You could take those classes right now virtually. They're being offered on so many platforms, and just create that plan for yourself, empower yourself for after. And lactation might be one of them, although I think there is, you have to actually get that latch, but you could form that relationship.
Exactly. So you have it when you need it, if you need it. Yeah.
Exactly.
I have a question I hadn't even thought of, but someone sent this in. Are hospitals still performing circumcisions, or are they considered elective?
They are performing, at least the ones I know of are still doing them, yes. But they're being done at certain times, not a lot of people together. You know, like everything else, we're trying to just space and book things instead of creating a scenario where lots of things are happening at once. But yes, they're being done.
It's incredibly reassuring to hear what you said about labor and delivery being this safe haven, and to remember that there are two specific changes, but other than that, everything's happening in lockstep. I think that in and of itself, you know, I think there are a couple of takeaways that I'd love to make sure we underscore to our communities even after this, and that's one of them. That's extremely helpful to hear, because there were a lot of questions like that around circumcision, and also with there were a couple women saying, you know, if they have a C-section, are there any changes in that protocol?
Except the gowning and the protection if you're COVID positive. That's it. Okay. But everything happens, the medicine is the same, you know, like what we would do medically, the steps, the procedure. And the more time goes on, the more exact those protocols become. Like, the more now we have the ability to test everyone. So that's even better, because you know from the beginning, if you have COVID, you don't have COVID. And if you don't, everything will go on as, you know, as it normally would. And if you do, then we have those protective protocols in line to serve you and the staff the best. So
is the hospital stay also reduced for C-section? Is it reduced for a day?
It's reduced. It's reduced for everyone. But if it's any reassurance, you know, I only stayed a day and a half after C-section in the hospital, and it was because I wanted to get out of there. So you know, if everything is good after delivery, your blood pressure is good, I vote go home, because the biggest problem is just you have to take care of your baby. That is hard, especially at the beginning. But as far as like being in a hospital, I often think, you know, you can get things in the hospital. You don't want to be in the hospital unless you have to be in the hospital. So
I actually wanted to stay in the hospital as long as possible. Please don't kick me out yet. I like every
nurses were good, right? Because they were helping with the baby.
Yeah.
I was the same way with our first and our second. I had vaginal deliveries, but I was like, get me out. Want to go home. Yeah.
I mean, it's true. The nurses are really good. They take the baby, you know, you can get a few hours of sleep. Yes, that is all true. But that's probably in this environment not worth the benefit of, you know, acquiring anything. But the thing that I would say in a hospital, which is how I think about it, is like there's the whole rest of the hospital, and then there's labor and delivery. And the whole rest of the hospital can be like designated to COVID, but labor and delivery will always be our protected space. So it's another way to sort of think about it. So in many ways, as far as healthcare goes, we're lucky. Like that's, our floor is not going to become a COVID unit. It's just not. So
good to hear. We have a sort of like legal question for you, but it's a legal doctor question. Erin, maybe you should roll this one out since you're the attorney.
Sure, I'll roll it out. I only have like half of an answer. So this woman, what she's saying basically is that she moved when she, earlier on in her pregnancy, and now she needs to establish a new practice. And the first practice that she reached out to said they couldn't take her. She wondered if they can legally not take her and then what she can do. What I know from a legal perspective is you have to be seen if it's an emergency. So if she's delivering, she has to be taken by a hospital. But I do think a private practice can say we're full up.
yeah.
And it's an opportunity for her to have to, reach in and advocate for herself and find a good practice that can take her. And that always kind of sucks. But unless my legal understanding is unless it's an emergency and she's actually in delivery or there's something going on that's emergent, a private practice can say that they're full up.
Yeah, I think there are private practices. I think that's right. There are private practices that, limit the number of pregnant patients that they take each month. So she probably just happened to call one of those and they probably told her they were full. Like, there are many practices like that will take, at max, like 10 women per month who are pregnant. So, yeah, I would encourage her to find another practice because she does want the practice to be a good fit for her anyway. Yeah. So, yeah.
Totally. Making sure we have everything hit here and everything. I see if there's anybody that's on the chat that feels like their question's been missed. Let us know. Someone asked if are hospitals still doing tubal ligation in conjunction with C-sections, or is that also considered elective?
That's a really good question. In New York State, you have to have legal papers signed 30 days in advance. It's a state law. I'm not sure about other states, but I feel like if you would sign those papers 30 days ago, you are probably okay. But I don't know 100% actually. I would just ask your doctor about that one. But I would just say, oh, remember those papers I signed? Yeah. Like, let's just make sure we can, because it's the same procedure. So it's not like you're having another surgery for your tubal. So I feel like there should be no question that it should be covered and done. If you were having a separate surgery just for that, it would not happen right now. But if it's part of your C-section, I don't see how they could say no.
What's it been like for you and with your patients now? Are you feeling like a lot of your work is emotionally based? Yeah,
I feel the stress that, women feel. It's a lot to navigate the system. It's a lot to be like a first-time mom trying to just figure out how to be pregnant and how to have a baby and then figure out all the rest of this mess. So I totally understand. And then for the women in New York that are like really underserved, it's so hard for them because many of them that I talk to have like other children. They don't leave the house even to go to the grocery store. And so they can't even get groceries. So literally a lot of the requests that I get are, can you help us get food or get diapers or get formula? And I couldn't even get things delivered to them. There were no delivery. I called up all of the groceries. I couldn't get any deliveries out to most of their homes. So, I just put the groceries in the car and took it to them. But these are only the people that I know about, you know what I mean? So it's tragic. It's really just upsetting. I hope that the end to this is soon.
How has there been an increase in maternal death in New York City?
Not that they've calculated yet, but I mean, it wouldn't surprise me if there was a small bump at this time. Just
non-COVID related, you mean?
Yeah. Because I feel like people aren't coming in. They don't want to come in. People are afraid, which I understand. I think, that really what I wanted to say here is we have to sort of weigh our fears, right? And yes, it's scary and hard, but we don't want other things to happen because we're also not accessing care and services. So I think, that's the flip side.
Well, and I think that's huge. And there are a couple questions that came through that were on the gynecological side of things. Just there was one woman saying she has a second ovarian cyst, can't get to the hospital to get a sonogram to check. And I just keep hearing you say, don't think that this isn't important. And healthcare workers are here as ever to help, not just people with COVID-19.
Yes.
Related to that. So call your doctor, get help. If
she's here in New York, look me up, send me a message. I will get her an ultrasound. And all our ultrasound places are open. That's the other thing that amazes me. Sometimes women will call me and they'll be like, well, we didn't think we could come in. We didn't think you were open. I'm like, where did I've been here. And I'm not alone. We're not closed. I mean, maybe there are some private offices that have been closed, but I don't know. Everyone I know is working. So please don't think we're closed. I know that it seems like everything is closed, but we're not. So if you're having a major issue, if you even think you might have an issue, do a televisit.
Mm-hmm.
Talk about the problem with your doctor. Imaging we can get. Their ultrasound places open, and more of them are opening every day. So
what's the best way to contact you?
Shirazian, you can Google me. There's there are no other I'm Googleable.
I want to give you a chance to tell us about the products that you've created.
Yes, we're running out of time. So thank you. This was so great. If anyone wants to reach me, actually, there are a few ways to reach me. You don't actually have to Google me. Savingmothers.org. You can reach me through the nonprofit. Dr. Shirazian is my Instagram handle. You can ask, a lot of people actually ask me questions that way. And then mommymatters.com is the next thing that I'm going to talk about. So I launched Mommy Matters. It's a social enterprise company. So basically what that means is we make a few products for women and mothers, and the proceeds from those products go back to the nonprofit, Saving Mothers. So for this month of April, the proceeds from every product that you purchase at mommymatters.com goes back to our New York City program to serve the New York City women. The first two products that we have are the portable pregnancy pillow. Let's see if you can see this. Let me move this back. So the idea behind this pillow, actually, I had this idea probably in a little bit of a better time when women and mothers were always on the go. But I think even for the stay-at-home mom, it's extremely valuable. It has a heat insert that you microwave for 40 seconds. You slide into the pocket, and it has a patented dual density core. Sorry, I just gotta push that in. You use it for back pain. So it's really great now for all the stress. You can use it sitting at your seat. You can use it in back of your neck for neck pain when you're pregnant. You can use it on the side for side pain under your belly. It's portable. You can bring it everywhere with you. It is super, super comfortable. I love this thing. I use it every day myself because of all the back stress that I have right now.
I was just going to say, I need that. And just so I get this right, is it NYMOM15? Is everything all caps, or is it
NYMOM15 all caps?
Okay, I'm going to put that in here.
We're giving you guys 15% off. This is available on mommymatters.com. It's also available on Amazon, but we prefer that you go to mommymatters.com. So
I know how that works.
And you can read our fabulous blog posts for mothers with all our health advice. And then our second product is this wonderful postpartum underwear. So all of our products are designed to prioritize the mom and to serve a unique need in pregnancy and recovery. So this product has a cooling insert. So it has a cool insert that you pull out and you ice, and then you can put it back into the crotch. So it's for your perineal or vaginal support after a vaginal delivery. It's got a mesh overlay for the C-section incision, for breathability, for comfort. It stands at the waist. It's machine washable. You can reuse it. You can use it for delivery and then reuse it on your period. So it's a very unique underwear that serves a specific need for the postpartum woman. This is also available at mommymatters.com. Also 15% with the code that we gave you. And the proceeds benefit New York City women this month. And
That's
actually,
fantastic.
Mother's Day is coming up. So if anyone wants to gift a product to a mom in their life, a friend that's a new mom, these make great gifts, and I think have a really sort of important message of prioritizing mothers, prioritizing women, and making sure that we take care of ourselves too.
And I love that. And I think that, you know, there's such alignment with what the three of us are all about. I always talk about the postpartum woman, rather than mom or mommy or whatever. You know, we're still women, just as we always are, having gone through this massive transformation. And I love your focus on maternal wellness, and staying focused on the woman, and just so grateful for that. And I just wondered, I know we're coming up at the top of the hour. I wanted to ask you, I think we're all feeling as individuals that we're having to grow very suddenly and all at once. I mean, we're being like shoved into growth, communicating with our partners, communicating with our kids. We're all school teachers now. We're trying to balance a million things. You in healthcare, you know, first of all, thank you for what you're doing. And for all of your friends and colleagues who are out there every day saving lives, thank you. And I just wonder if you feel like maybe the way in which the healthcare system and individuals in healthcare are being forced to grow now, is there a positive in that? Are you seeing some progress and some developments that this intense growth is leading to?
I think so. I do global work around the world. So I feel uniquely positioned in this time because of all the work that I do around the world taking care of women in areas where we have nothing. I mean, we're lucky if we have one pair of gloves, let alone a clean pair of gloves, you know, every day, or one face mask, let alone a face mask for every patient. So I think resource conservation and understanding what we have and using the things we have in the best way is something that's been like at the forefront of my mind, because around the world, people understand that a little more than we do in the United States. We're used to certain technologies and luxuries that, you know, that are often a luxury, you know. So I think that is something. I think just the way in which we conserve, thinking about our environment, thinking about our planet, thinking about making sure that we are part of the global efforts to improve ourselves and to improve our communities and environment is a really important piece of this. And I really hope that we learn from that. And I also hope that we learn some better disaster management and, you know, what to do when there's like, you know, how we can forecast. We should be predicting these things, right? We should be on the forefront of thinking about what we're going to do next time.
Yeah. Yeah.
And I think something that I've learned, which is still upsetting to me, is like the schools, right? We can't not have school forever. Like there needs to be a plan, right?
Yeah.
We need a plan.
Yeah.
That'd be nice. I'd appreciate the plan.
Appreciate a plan.
Yes.
Plan.
For every aspect of what we do and how we live, we need to use this as an opportunity to plan ahead. Like, you know, if we think there's going to be a second wave in the fall, let's think about that right now. Like, we need school in the fall. Like, please.
Yeah.
Please.
Work out if there's no school in the fall. I give up.
Right.
Yeah. I don't know. White flag over here too.
I know.
Well, that's great. Thank you for that. And I think we're Alexis and I dropped in your presence online and your Instagram. I'm going to go ahead and drop in at Totum Women I, like you, offer a product to women. We offer a lactation cookie mix that they taste fantastic and they really work, and they're all organic and kosher and all that good stuff. Another great Mother's Day present. And my big passion is just the community and support. So I want everybody listening. I know we're at the top of the hour, so anybody that's still here, please know that you're not alone. You're not alone, you're supported, and you matter now as ever.
And please reach out if there are any other questions. If you guys need anything, please, we take questions at mommymatters.com. You can ask me at Dr. Shirazian. I'm happy to answer any health specific questions, anything I can help with.
That's fantastic.
Thank you so much. Thank you, guys.
Thank you for being here. Thanks, everybody.
Have a great day.
Bye. Thanks, you too.
Be well.
You too.